record. Good afternoon, everyone. Welcome to the Sex Ed Works strategy call. Before we get started, I'm going to turn it over to our Spanish to English interpreter to talk about interpretation, and then we'll get started. So Sylvia?
Thank you, Carla. You can all hear me, right? I'm going to start sharing my screen. Okay, and let me show the. Sorry about that. I lost the. I'm sorry about that. 1 second, please. I'm going to stop sharing. Somehow I lost my. So I'm going to try to do it actually without the screen because I lost the presentation. But if you look at the bottom of your screen, you can see a globe if you're in front of a computer. So all you have to do is go to that globe, click, and you'll see the two different options, which is Spanish and English. So once you get into the channel, you're going to be able to hear me and everybody will be able to communicate with each other normally. Si están enfrente de una computadora, lo único que tienen que hacer es ver en el panel de abajo y buscar el globo terráqueo. Hacen clic ahí y pueden ver los canales que están ahí, pueden escoger español e inglés. Todos vamos a estar en un canal para que podamos comunicarnos bien. Now, if you're using a phone or a tablet, then the instructions are a bit different. You have to go to the three dots where it says more. In the menu that displays, find the option language interpretation. And if you cannot see it with your finger, you can move up and down the options and you'll find the language interpretation up button. You click there and then you'll see the channels, English or Spanish. And the most important thing here is that once you have selected a channel, you have to click done. Si están enfrente de una tableta o un teléfono, es muy fácil. Tienen que buscar los tres puntos donde dice más. Ahí les va a salir un menú desplegado con varias opciones. Selecciona la opción interpretación de idiomas. Y si no la pueden ver rápidamente, con su dedo pueden mover las opciones y la van a encontrar. Ahí pueden escoger el canal que deseen y finalmente tienen que hacer clic en donde dice finalizado, porque si no lo hacen, no van a entrar al canal. En un momento, cuando yo vaya a los canales, van a poder escucharme. Ahorita todavía no. All right, so I'm not in the channel yet, so you cannot hear me but in the channel, but I'm going to go to the channel and you're going to be able to hear me in English and in Spanish. So 1 second, please. Spanish.
Muy bien, Silvia. Yo la escucho bien.
Very well, says Ori, she can hear me. So the channels are working.
Thank you so much, Sylvia, for guiding us through setting up the interpretation. So we will get started today. I'm sorry. Yes. So first, we're going to start by introducing ourselves. So I'm going to turn it to over to Audi to introduce ourselves.
Buenos días
Good
a
morning
todas,
to
todos,
all of
todes.
you.
Para mí es un gran honor el
For me,
este
it's a
día
great
estar
honor
presentando
today to
juntamente con
be
Carla.
presenting together with
Mi
Carla.
nombre es Auri
My name is
Aguilar,
Audi
soy una miembro de
Aguilar,
Sanando en
and I am a
Acción
member of
y
Healing to
participo
Action, and I do
activamente en la
participate
coalición de
actively in
Sex
the
Ed Work.
coalition
Nuestra
Sex Ed
coalición
Works.
está
Our
formada por
coalition is
jóvenes
formed by
educadores
young
y
people,
cuidadores
educators, and
para garantizar
caretakers
que
to
todos los
guarantee that
jóvenes puedan
all
acceder
young
a
people
una
have
educación
access
sexual
to
integral
a
de alta
comprehensive
calidad,
sex ed that has a high
independientemente de su
quality
código postal.
independently of
Por
their
eso formo
postal
parte
code.
de esta
That is the
coalición.
reason why I am
Gracias.
participating in this coalition. Thank you very much.
Thank you, Audi. And my name is Carla Altmeyer, and I'm a co-founder and co-director of Healing to Action. And we are part of Healing to Action. So our organization's mission is to end gender-based violence by building the leadership and collective power of the communities most impacted. And today we are going to talk a little, before we get into this discussion, I wanted to share a couple of things about our work or about like what you can expect today. So I do want to share that we are recording this lunch and learn because we want to make sure that it is accessible for folks who cannot attend. If you do not want to be seen, please feel free to close your camera. We won't be publishing any identifying information. It's just really our own present portion of our presentation. The second thing that I want to go through is we are talking about a topic that is really important, but can also be triggering to folks. We ask you all to please hold this as a safe space for everyone and treat everyone with respect and dignity. Lastly, we want this to be as close to a dialogue as possible, but we are also mindful of time. We do ask you to mute yourselves. There will be a break for a Q&A. And if you have any pressing questions, please put them in the chat box. And our moderators, Jocelyn and Patricia, will make sure that they are answered, whether we answer them verbally or in the chat. And if you have any questions or think we should add anything else, please put that in the chat box, and we will address that. So I want to turn it over to Audi to move us through the grounding in dinámica. Audi?
Gracias, Carla.
Thank you,
Pues nuestra
Carla.
dinámica del
Well,
día de hoy
today,
es
our icebreaker,
algo muy sencillo.
it's something really
Vamos a
simple.
recordar
We're going to be
nuestra
remembering
experiencia,
our
tu
experiences,
experiencia, mi
your
experiencia, la
experience,
experiencia de
my
cada quien
experience, our
am,
experiences
sobre la educación
regarding
sexual cuando eras joven. De
sexual
quién o
education
dónde
when you
aprendiste,
were young.
qué
From
aprendiste,
whom you
qué te
learned?
hubiera
What did you
gustado
learn? What
aprender.
would you have liked to learn?
Y puedes
And you
introducirlo en
can
el chat,
also
como dijo
put it in the
Carla,
chat
o
as
también
Carla
lo puedes
mentioned,
decir
or
aquí
you can also say it
en el
here
público, pues todo es
in the
bienvenido.
microphone. Your
Tenemos
contribution
10
is
minutos
welcome.
para
We
pensar,
have only
para
10
escribir y
minutes to
para
think,
decir lo que
to
pensamos
write, to
sobre
say what we
esta
think
dinámica del
about
día de hoy.
these questions.
Y si no se les quedó muy bien, pueden
And if
preguntarme otra
it's
vez y
not
se los
clear,
puedo leer otra
ask
vez
me again. I can read it
sobre
again.
cuál es la
So
dinámica.
what the questions are if you don't remember them.
Audi, I'll actually answer. the question, and then maybe someone else. We could maybe wait for one other person to answer as well, or two
Claro que
people.
sí. Claro.
Um, my experience of sexual health, I had two experiences. One was when I was in fourth grade, and I remember my mom opting me out. So I could not attend the sexual health education class. And instead, she said that she took it upon herself to explain to me puberty, which was one form of sexual health. That's one part of the information. So she explained it to me, but that was it, and it was not scientific. It was very much like, this is what, well, I mean, some of it was like, this is what happens in your body, this is what you can expect. And I did appreciate that, because I was prepared when I had my period for that. And then in high school, we had sexual health education, and I remember them drilling down abstinence only, no sex, never have sex, only, um, only, don't, yeah, but there was never a discussion about what does consent mean. There's never a discussion about what healthy relationships mean. And I realized after I had children that I had no idea, or when I was pregnant, that I had no understanding of my own body at all, and how disconnecting that experience has been. So, yeah, that's my experience of sexual health. I don't know if there's one more brave person that would be willing to share their experience. I see, Janine, you put in,
Gracias, Carlos.
Thank you, Carla.
Audi, I see a couple people in the chat, so if you don't mind, I'm going to read them. Um, so I think Janine shared my
No,
sex was,
Carla, claro que sí.
okay, sorry.
Of course, Carla, don't worry, go ahead.
My sex ed was minimal. I learned how babies are made from my mom, and then how not to get pregnant from health teachers. I wish I would have learned about body autonomy and healthy relationships. And then Kate shared, I do not remember having learned much in the only sex ed class I had in middle school. I only remember that our class was shown a video of a live birth, which caused a huge uproar. I wish I had learned about all the fundamentals. And then Rocio, I don't know if you want to read Rocio, what she wrote in the chat.
Ah,
See it.
sí. Dice Rocío,
Rocio
yo
says,
aprendí en los
I
libros que
learned
nos
through
daban en la
books
escuela,
that
pero
were given to us at
cómo
school, but
nacen los niños,
about
no
how
todo. Pues me hubiera
kids
gustado
are
aprender más
born,
sobre mi
but it
cuerpo.
wasn't enough. I would
Gracias,
have liked
Rocío.
to learn more about my body.
Am,
Thank you, Rocio.
También hay otro
But I
en
also
español.
see
Dice,
something else in
ah,
Spanish. It says,
no recuerdo haber
I don't
aprendido
remember having
mucha,
learned a lot
mucha
about
clase de educación
sex
sexual
ed in my
femenina
only
en la
class I had
escuela
in
secundaria.
school.
Solo
I
recuerdo
only
que en
remember that
nuestra
our
clase le
class was
mostraron
shown
un
a
video de
video of
un
a live
nacimiento
birth,
vivo y lo
which
que
caused a
causó
huge
un gran revuelo.
uproar.
Ojalá hubiera aprendido
I wish I
todos
had
los
learned about all the
fundamentos.
fundamentals.
Oh, muchas gracias por eso.
Thank you for that.
Am, sí,
Um,
eso es todo lo que
yeah,
tenemos.
that's all
¿Alguien
we
quiere
have.
decir algo
Anybody would like
más?
to say something
Am,
else?
I
o-
think, Audi, we could probably
Uh,
keep moving, for the sake of time.
sí,
yes,
ok,
Carla.
está bien.
All right, that's fine then.
Pues
Um,
muchas de nosotros
well,
no
many of
tenemos una
us
buena
don't
respuesta
have a
porque
good answer to these
no
questions
recibimos
because
este
we did
tipo
not
de
receive
educación
that
en
kind
nuestra
of
infancia.
sex ed
Algunos de
when we were
nosotros
kids. Some of
mencionamos
us,
que aprender
we
sobre
already
salud
mentioned
sexual a
learning
temprana
about
edad
sex ed
y tener
early
un
on and
espacio seguro
having
para
a safe
platicar nos
space to talk
hubiera
about it would
ayudado
have
y una
helped us a
experiencia
lot,
diferente sobre
and
nuestra
it would have
educación
led to a
sexual.
different experience
Por lo
regarding
menos yo
our
cuando era niña,
sexual
mi
experiences.
mamá
When I was a
pensaba, ay,
girl,
esta niña
well, my
está
mom thought,
chiquita, todavía
oh,
no le
she's a
debo
young
de
girl.
decir
I should
cuándo
not be
le va a
telling
bajar
her
su
anything about her
menstruación.
period.
Yo tenía miedo
I was scared
am,
when,
por cualquier cosa, era una niña muy miedosa.
well, I was a very,
Mi mamá nunca me
fearful
habló sobre
girl, and
nada,
my mom
que
never
qué
said
le pasaba a
anything
las
about what
niñas o
happens
algo.
to
Ella
girls.
pensaba, yo estoy
She
chiquita,
thought,
pero no es cierto.
oh, that I was just a young
Desde el
girl,
día
but
que
it wasn't
entendí que
true. I
uno
learned
tiene
from
que
that
hablar con
that
sus hijos,
we have to
uno
talk
puede
to our
pensar que la
children.
educación
We
sexual
can
es
think that
solo
sex
cuando
ed
ellos ya
is
son
only
adolescentes
when given
y
when they
tengan
are
sexo, una
teenagers
relación
and
sana,
when
una
they are ready
relación
to have sex so they can have
para
a healthy
respeto con sus
relationship.
compañeros,
They
no.
can have
La
respect.
educación
But
sexual
no,
para
actually,
nosotros, los
sex ed
padres,
for
es
us as
cuando nuestros
parents
niños están chiquitos, cómo respetar a
starts
sus
when kids are
compañeros,
really young,
cómo
and starts
decirles
by
los
telling them how
cambios
to
del
respect their
cuerpo de
peers,
uno.
telling them about the body
Am,
changes they're going to go through.
Esa es mi
So for
experiencia cuando
well,
yo
that is my
era
experience
una
when
niña.
I was a
Me
young
asusté
girl.
cuando me
I
bajó mi
was
menstruación como
afraid when
apenas
my
tenía
period
yo
came
8
because I was
años.
only 8 years
Y
old.
pues
And
es algo espantoso
it's
para uno
something
mirar sangre
horrible to see
y
the
sin
blood
que nadie le
as a
explique a
young
uno
girl,
qué
and
es.
nobody has
Salí
explained to you
corriendo
what
de mi
that
clase
means.
y eso
So
para
I
mí
left my
me
classroom,
impactó toda
and
mi
that
vida y
had
por
a
eso
big
es que ahora
impact.
enseño a mis hijos
And that's
cómo
why
sus
right now I'm
cuerpos están
teaching my
cambiando a través de
kids
la edad.
how their
Y
bodies
agradezco
are
mucho
changing. And I'm very thankful
lo que
for
compartieron, por los
what you
pensamientos
shared,
y
your
feliz
ideas.
platicarlo.
And Carla, now it's your turn.
Thank you, Audi, for for sharing your own experience and for guiding us through this grounding experience, grounding activity. So the reason why we started out with that question was to kind of help ground us in what has been our experiences and what do we hope happens for the future generations. So today in our agenda, we're going to first review what comprehensive sexual health education is and what it should look like in practice in schools. Next, we're going to understand the current state of implementation of sexual health education and the state of sexual abuse within CPS. And then we'll share our strategy for moving the district to implement sexual health education at the district level. And we'll end with steps that you can take on how to ensure the proper resources are invested. And we will follow up in an email with links and documents for everyone who's registered with toolkits and information of how caregivers can begin to take action on addressing sexual health education in their communities. So what we're going to start with is a brief overview of what is comprehensive sexual health education. A lot of times when we think of sexual health education, we think of puberty, we think of sex, we think of uh, sexually transmitted infections, and those are all part of sexual health education. That is true. However, comprehensive sexual health education is more holistic. It is age appropriate and medically accurate education about sex and sexuality. It also includes information about how you practice consent. And it's also about how do you maintain healthy relationships. So it's much more broader than when we initially might think of what sexual health education can be. And it actually begins from pre-K through 12th grade. And the important thing to note is that that comprehensive sexual health education centers consent. That is the big message from comprehensive sexual health education. And it challenges gender-based norms and power dynamics. When I use the term gender-based norms, I think sometimes people think of the LGBTQ plus movement. That is one way it challenges, but it also challenges gender norms that keep both, all gender identities confined to certain expectations and power dynamics. So I think of an example of when we think of, you know, young boys, maybe they're told not to cry, right? Or young girls, they're being told to be quiet. So I think, again, this is really about helping expand those expectations and shift those expectations so that so children are able to live fully and freely as who they are. Consent-based sexual health education supports bodily autonomy and self-advocacy, and ultimately empowers young people to stand up for themselves and stand up for their peers. So what does this look like? Because I know oftentimes when parents think, oh my gosh, kindergarten, how are you teaching sex ed in kindergarten? What does that mean? Well, it's actually again, the key is age appropriate. So in kindergarten, you're not learning about sex. You're learning about how do you share your feelings. You're learning about tools like surprises versus telling secrets. Those are tools that are so necessary to prevent child abuse, right? If children are better equipped to understand what does consent look like, what is a surprise versus a secret, then they're able to tell their trusted adults, hey, this happened to me, or this other thing happened to me. You see that even like when sex is actually being discussed, it's really later. When you're thinking about, okay, what is sexual abuse in 8th grade? You're starting to understand what can assault look like. You're trying to understand what is a red flag. Again, you're trying to identify what is a healthy relationship and what is a relationship that's harmful. So all of these tools are intended to be information that youth can then use to better protect themselves and assert their bodily autonomy. So what does the implementation of comprehensive sexual health education looks like at the district level? The district actually has a curriculum that is fairly progressive, that's in alignment with the National Education Sexual Health Standards. But that's why we want to talk about what the implementation of that looks like, because that might look very different. So we're going to play a quick game of true false here. So let's start with this first one. And so true false. Chicago Public Schools data reveals that 85% of schools implement the sexual health education policy. You can put it in the chat. Is this true or is this false? Yes, I see a couple of answers here of false. For folks who said false, where do you think CPS is on the implementation? Wow. I will show you. So false. That's correct. 30. Yeah. I mean, the district has about 600 schools, like 549 schools, almost 600 schools. Although that has been shifting, that number has been changing. I'm not sure why, but 2 and 3 schools are not implementing sexual health education as promised by the policy. So you can have a decent policy, you can have a really good curriculum, but the reality is that doesn't guarantee the implementation. So I'm going to turn it over to Audi to guide us through the next one. Oh, Audi, you are on mute.
Sorry.
I'm
La
so
mayoría de los
sorry.
colegios que no han
The
implantado la
majority of the
educación
schools that
sexual
have not
se
implemented
encuentra
sex
en
ed
la zona
can
sur
be
y
found
oeste de
in the
Chicago.
south and west sides of Chicago.
verdadero. La mayoría de estas
True.
escuelas se
The majority
encuentran
of
en
the
la
schools
zona
are
sur
found
y
in the
oeste de
south
la ciudad,
and
lo que
west sides of the
significa que
school,
los
which means
jóvenes
that
negros y
young
latinos
people who are
tienen
Black
menos
and Latinos have
probabilidades de
less probabilities
recibir
of
herramientas de
receiving
educación
tools,
sexual
sex ed
que sus
tools,
otros compañeros en
than
la zona
other
norte.
peers in the north side.
Am, ¿Sigues, Carla?
Carla, now you
Yo
can go
sigo
ahead.
con los
Or should I
educadores.
continue?
No, I'll continue. No worries. Thank you, Audi. One thing that I want to just
Okay.
mention is that the North Side's implementation is still not great, but you can see this map, and this is from a 2018, from the Healthy CPS 2018 report. It still shows that it's significantly more implemented on the North Side than it is on the South Side. This still remains true to today. Even though this map is reflecting of 2018, it's the same percentage essentially for 2024. So the next one, the sexual health education policy in CPS is mandatory but not funded. True or false? What do folks think? Yes. So yes, I see true in the chat, and yes, that's true. Sexual health education policy is rooted in the state policy. So the state of Illinois has passed a policy to implement sexual health education, but it's not funded at the state level. So that doesn't really give an incentive for local municipalities or counties to fund it as well. And in the Chicago Public School policy, it is a mandatory policy that is not funded, which creates a big contradiction because it's not implemented. So there's no real accountability to it being a mandatory policy if it's not being implemented, and that the rationale is because there isn't funding. So that's something important to note. And yes, here's the true slide. And it's also not federally funded either. So that's something that is, if we really want to end gender-based violence, we have to invest in sexual health education in order to do so. And then the next one, Audi, I think this one's yours.
Okay. Bueno, los educadores
Well,
para la educación en salud
educators
sexual deben
of sex health, they
una
need to complete
formación de
a
3
3-year
años
training
para
to
impartir
teach
el
the
plan de
curriculum.
estudios. Falso. Los
False.
recursos
The
actualmente
resources
asignados
currently
incluyen una
allocated
formación
include
de
a
3 horas
3-hour
para
training for
educadores
educators
una vez
once
cada
every
4
4
años.
years.
Thank you, Audi. And I'm sorry, the slide says true, but it is false. Yes, it's a 3-hour education. You don't even have that when you drive, so I don't know. The next one. So principals should hold mandatory workshops for parents to provide an overview of the sexual health education curriculum. What do folks think? This one, I worded it tricky on purpose. So that is false. So in, yes, Janine says it depends on if they are prepared for it. Otherwise, it could be damaging. So the city CPS has a policy. The policy does not require principals to does not require principals to share this information with parents in that way. The policy does require parents to receive 3 notifications of sexual health education, that it will happen. And then they are encouraged through the implementation guidelines to have an open house or an orientation for caregivers, but they are not required to do so. So that's just something for folks to note here. So I want to share. I want to pivot to the sex ed work demands and why, and what our campaign is focused on. Sex ed works is a result of survivors of gender-based violence, who've been organizing with Healing to Action. And I'm going to turn it over to Audi to share more about why sex ed works happened.
Sex Ed Works
Sex
es
Ed
el
Works is the result of survivors, gender-based violence, gender survivors who are seeing the connection between their own experiences of sexual violence and what the kids are going through nowadays. So we have joined to young people and educators because it is not only about having access to comprehensive sex ed, it is about making sure that all of us have the tools to give consent, to feel
consentimiento de
to give
sentirnos
consent, to
seguros en
feel
nuestro
safe in our
propio
own bodies and
y
communities and
comunidades
have
y tener
healthy
relaciones sanas.
relationships.
Se trata
It
de
is about
acabar con la
ending
violencia de
gender-based
género para las
violence
próximas
for the
generaciones.
next generation.
Desde el
Since
noviembre del
November of
2019
2019,
hemos
we have
colaborado con
collaborated
más de
with
300
more than
jóvenes
300 young
educadores y
people,
cuidadores
educators, and
para
caretakers to
desarrollar nuestras
develop
3
our
demandas
3 key
claves.
demands.
Sigues, Carla.
Carla, go ahead, please.
Thank you, Odie, for sharing that overview. So I'm going to briefly go through the demands of the Sex Ed Works campaign. The first demand is district-wide funding for equal access to sex ed, regardless of the zip code. Sexual health can't happen without funding to support the implementation. And this means funding to pay educators for high-quality training. This means funding for more materials and resources for equipping caregivers. Ideally, and I know the district is struggling right now with the budget, but ideally we would have funding for a teacher in every school dedicated to the implementation of sexual health education. That's what it would require. That's the level of resources it would require to fully implement sexual health education. The second demand is that there needs to be support for caregivers to understand and teach youth about healthy relationships at home. And it has to be meaningful community support, community-based support. I'm sure that many of you on this call, I'm very curious to know how all of you feel on this call to talk with a young person or someone else about questions you have with sexual health. It's not easy to do so. And for a young person, the most important relationship is that between a young person and their caregiver. And so what this ideally should look like are in-person workshops led by caregivers for caregivers in their schools and communities, in collaboration with an educator or a community-based organization to share this information and these concepts that youth are learning so that caregivers can navigate these conversations more effectively. And then the last demand is a voice to make sure that sex ed is taught in all of CPS. And what we mean by a voice is ensuring that there's accountability so that community members can hold CPS accountable to ensure that sex ed is being taught. Again, this is a mandatory policy that is not being implemented. And so our goal is to really build the power of local school councils and of caregivers directly in the community so that caregivers can advocate with their local school councils, with their principals, and with the district to provide resources for caregivers and be supportive allies. And I want to just share the unfortunate bleak impact when there isn't sexual health education in CPS. In 2024, the Office of Inspector General reported that Chicago Public Schools saw a 12% increase in reports of sexual assault and violence. And out of 4,000 cases that were reported, they only investigated 1 in 3. So it's really important, and our ultimate goal as our campaign and as an organization is to disrupt gender-based violence for the next generation. When there's funding, when there's support for caregivers, when there's clear accountability, we envision that CPS youth will have those tools to have healthy relationships and ultimately reduce community violence. So I want to move to our strategies now for the campaign and what we've been doing. So there's been 2 critical strategies. The first has been a school-based approach. One of our approaches has been working with a school within the district to develop a blueprint for other CPS schools. In 2022, we collaborated with Walsh Elementary, a school of 300 students in Pilsen, that had a better track record of implementing sexual health education. And the idea has been that if this school could provide sexual health education to caregivers, that the caregivers would then inform how the LSC or local school council can allocate funds to support the implementation of sexual health education. One critical outcome of these workshops and of developing this blueprint, we're still working on building the power of the local school council, but caregivers have actually started to disclose cases of abuse that have happened at the school and are starting to build community and support with one another to address this problem, which is significant. So that's one strategy that we've been doing. The second strategy has been a district-based strategy. So it's district-wide strategy. At the district level, members of the Sex Ed Works campaign have advocated with the CPS school board members and the Chicago Public Schools members of the Office of Student Health and Wellness after many years of advocacy with support of the City of Chicago's Gender-Based Violence Task Force, Healing to Action has been able to successfully pilot a workshop model with the school's parent university networks. So by leveraging Parent University, which is a hub for networks of different schools, our hope is that there is some accessibility for accessing sexual health education for caregivers that currently can't happen in schools because of resources or haven't happened because of resources. And the impact of the pilot that we did earlier this year is motivating the district to expand this approach, which is something, and again, it's moving in the positive direction. That said, there are hundreds of schools in the district, and not everybody can access Parent University. So ultimately, what we need is we really need to continue to do a grassroots school-based approach, working with local school councils, and also this district level approach to ensure that we actually get high quality sexual health education implemented in schools and to ensure caregivers receive the support they deserve. So what are action steps that you can do? So here's the first. I think the first question you can ask yourself is, who is teaching sex ed at your school? Currently, every school should have 2 educators, 2 teachers who are certified to teach sexual health education at your school. So who are they? Is it the gym teacher? Is it the science teacher? Is it the math teacher? When did they get their training? Are they doing any supplemental training? Or are they getting any other resources? Is the school partnering with a community-based organization who can provide additional support and resources? And if they are working with an outside provider, how is the school ensuring that there is a trusted adult that youth can go to ask questions within the school. So these are questions that you can ask your principal, you can ask your local school council, you can ask them, what is the plan for implementation here? These are questions that you can ask your principal in your school. Another step that you can take is understanding what your kids are learning. So if you are a parent where you're feeling unsure about the content, and I understand most of the time, the reason why we are unsure of the content is because, and I am a parent of 2 children myself, is that we as parents don't feel comfortable with the content ourselves, right? If we don't feel comfortable with talking about it, then we're not going to feel like our kids are capable of understanding or can understand the lessons. So inform yourself. What are your kids learning? There are several documents that the school has that they can share with you. One is the scope and sequence document, and all of this will be linked for you in the email, and they're also hyperlinked in the slides. But the scope and sequence provides an overview of the curriculum in the sexual health education. There's also this tool called Curriculum Connection, which I'm going to see if I can click on it here for you to see really quickly. It's a website that it's on their website of like, let me just see, connection. Just pull it up here so that you can just see what I am. So let me stop share and then share again here. So this website that CPS has a lot of the documents, information you'll see. There's the scope and sequence, there's the policy here, the national sexuality education standards, and then there's information here about like books that you can read and resource, overview for parents, the curriculum connection. Here's the resources for parents. So there are materials here that you can look through and inform yourself more about the content so that you are better able to feel like you can support your kid or be able to start to have those conversations. Again, I think information is very helpful to be able to do that. But, and so the other question, to think though, is like, you can, you might be able to say, okay, I will read about this, but what are the other parents doing in your school, right? What are the other community members doing? And so asking your principal, what are the tools provided to the community to support conversations with youth? I would encourage everybody to review the Chicago Public School Implementation Guidelines. It is in English right now. I've noticed that there's a lot of materials they need to translate into Spanish and other languages, but this is something that you can go through and read or bring to your local school council and say, are there resources that we can allocate to having an open house, having an orientation around sexual health education? And then this question, right? What if you do all this investigation? So you've taken the first step, you've done investigation, and you found out your school has absolutely nothing. This is when action can be taken, growing that action can be taken. One would be attending your local school council meeting. So attend those meetings. I know a lot of parents don't attend those. Join the local school council. If your local school council has less people on the local school council than the number of seats, you're creating the community is not really having a voice at the table. And know that there is the BAC and PAC, which they have discretionary funds for caregivers to receive training. So if the local school council says there isn't any money, or the principal says there isn't any money, you know that the BAC stands for, I think it's the parent, the BAC is the Bilingual Association, and then the Parent Association, that's the PAC. So both of those have access, can provide discretionary funds. And sorry, if someone wants to correct me in the BAC and PAC, we could put it in the chat. So after today's call, we are going to share with you our toolkit. We developed a toolkit to better understand the issues of sexual health education in CPS. We will share with you a link to the policy. The policy is translated into English and Spanish and other languages. The implementation guide or the implementation guidelines that your principal for sure received, but is likely not using. So you can use that to have a conversation with the administration of your school. And then our resource guide. We have Healing to Action has provided a resource guide for survivors of gender-based violence, but really it's a resource for anyone who's experiencing harm. Because as I said, unfortunately, once these conversations of sexual health education begin, there might be disclosures. And so the question is, how do you address these disclosures? And then I'll also share information about what happens if you have a disclosure of abuse. What are steps that you can do within CPS? Ultimately, I think if you want to take another step is to join the Sex Ed Works Coalition meetings. Jocelyn can put in the chat the date for the next coalition meeting, and she can make sure to invite you so that you can stay attuned and learn more about how you can play a role in the district-wide approach or at the local school level strategy. But I'm going to pause it. I'm going to stop now to see if there are questions and open it up to questions and dialogue. And feel free to unmute yourself if you have questions, or feel free to put your questions in the chat. One question that I think someone asked in the registration that I wanted to answer was, how is funding allocated on a district level, network level, and school level to ensure proper sex education? So we did answer this. There is no allocation at the state level. There is no allocation at the district level or at the network level. The current funding stream for sexual health education is through the CDC, or the Center for Diseases. I forgot the name of the acronym, sorry. Centers for Disease and Control and Prevention. So currently CPS receives federal funding for the implementation of sexual health education through HIV prevention dollars. That is the funding that they receive, which I believe limits some of what they can do, but not everything. The state does not have, the district, to my knowledge, does not have a strategy for funding sexual health education more long-term. It really just falls on the on that Office of Student Health and Wellness to apply for that funding. And I think the other question was, how do schools identify community partners to bring in? So there is a list of community partners, which I will also share with you all. It's this, and they are also members of what's called the Sexual Health Advisory Committee of CPS. You can always email the Office of Student Health and Wellness to ask for what are resources for my school to connect with to provide sexual health education. That is a request that they're starting to answer. So I think that's something folks can do. And then the question is, what steps can students, educators, and staff take if they feel their sex ed is not inclusive or harmful? I think the first step is really informing ourselves exactly what is happening in the classroom, what is happening in the curriculum, what is being really informed about that. I think the concept of harm is very broad. You have some parents who feel like it's harmful to talk about transgender identities. You have some parents who feel like it's harmful to not talk about that. So I think the important piece is understanding for yourself, what is it that's being taught, what is happening, and if there's a sense that it's non-inclusive or it's discriminatory in any way, filing a report with the principal is the first step. And then, I do think, again, the Office of Student Health and Wellness is important to have, to talk to and say, hey, this is happening. How can I get support? I also think that going to the local school council can be helpful because the local school council holds the principal accountable. I'm seeing some questions in the chat here. So let me see. If a principal is interested in hosting an open house introduction to sex ed but wants support, can we come to H2A to support them? Yes, you can come to Healing to Action to support that principal. We could potentially do that. Our role is not really to do that directly, but there's so many other we can, but there are so many other organizations that do that. So we can also just talk with the principal, give them some tools, connect them with some organizations that we've collaborated with, and that they can then bring them in. For caregiver support, that is something that we do specialize in. But again, we would probably partner with a community organization that can continue once we started. So that's someone you can definitely reach out to us for. I see another question here. I would love to connect with you later. Okay. Yes, and yeah, there are potential collaborations and partnerships that can happen. Let me see if there's any other questions. Okay. This is from Jasmine. I'm wondering if you all have any other resources in Spanish for caregivers, such as books, videos for sex ed. CPS curriculum often focuses on English resources that often leave out Spanish speakers within the sex ed curriculum. We don't have that at the moment, but we can build it out. And we can share some of them with you. As a parent, I have my own personal resources, so I'm happy to share those with you all, and that will probably be the basis of what we start to build on. But I agree, it is the materials out there are centering certain identities and certain communities, and it makes it difficult for people to feel connected, and also just not available in all of the languages. So I'm happy to share some resources in the email as well. Any other questions? Somebody had asked in the registration, I'm curious about creative ways to implement comprehensive sex ed in a way that all students can benefit and not need parental consent. Here's the thing with that. That is, well, first, it is a state, like the state requires an opt-out provision for parents. I think if they made it mandatory across the state, there will be so much uproar. So there's an opt-out provision for those parents who really don't want their children to participate. And I think that it's important. That's why it's so important to have caregivers engaged in these conversations, because you want caregivers to be a part of this. You want caregivers to be that trusted adult that when the kid leaves school or they transfer schools or they have that resource in their space to support them with consent, to support them with practicing healthy relationships. So it is so critical to have an intergenerational approach to sexual health education. Audi, I don't know if you want to add anything else to what has been said.
Perdón, Carla, ¿me dijiste a
I'm
mí?
sorry. Are you calling
sorry.
me?
Yes. I just said if there's anything else you want to add to what has been said.
Pues me siento muy
I
emocionada
feel
por
very
todo lo que
excited
estamos
about
platicando en esta reunión
our
y pues
conversation.
me hubiera gustado que
I
más
would have
padres se hubieran
liked
unido a
more parents to
esta
come
conversación
today to
porque
this
es algo
conversation
que
because it is
debemos de
something that
aprender,
we all
especialmente los
must
que
learn,
tenemos niños
especially
pequeños y no saber
those who
cómo
have
interactuar con
young
ellos.
kids and
Muchas veces
we don't
pues
know
nos
how
da
to interact with
miedo
them
de
because
hablar
we are
o
afraid of
ellos con nosotros no
talking,
nos tienen
or
la
they're afraid of
confianza
talking to us.
porque,
They don't feel
bueno,
that we are
por
trusted
experiencia
adults.
digo, cuando mis hijas estaban
When my
chiquitas,
girls were
siempre me
young,
decían las cosas que les
they
pasaba en la
would
escuela,
always tell
pero
me
cuando
what
fueron
was happening to
creciendo,
them when
ellos como
as
que
they
ya
were growing
tenían un
up.
poquito de pena de decir
They
las
felt
cosas,
shy, they did
pero
not want to
yo
tell
soy
me
una
things,
mamá así muy
but I
comprometida
am a mom
porque
that
es que
is very
pasaron muchas
nosy
cosas en mi
and
juventud, por eso yo no
involved.
quería que
That's the
eso
word.
sucediera con
A
mis
lot of
hijas.
things happened to
Entonces,
me when I was younger, and I
siempre
did not
estaba
want my
yo
kids to go through
diciéndoles
the same thing.
cosas
So
que
I was always
pasaban en
telling
otro
them
lado y
things
entonces ahí
such
es
as,
donde
oh,
se abría
this
la
can
se
happen,
abría
this happens elsewhere. So
se
that
abre
way
una conversación
we could
con
open a
ellas cuando uno empieza a
conversation
decir,
when you
oh,
say,
la
hey,
hija de tal y
oh,
tal
the daughter
persona,
of
aunque no
so
puedo
and
decirles
so,
nombres a
I
eso,
cannot tell you the
oh,
names, but
una
the
hija de
daughter
la
of so and
señora, pues le
so,
pasó
or
esto y
a
ella
lady,
tenía
an
miedo
ex
de
lady,
decirle a su mamá, pensaba
uh,
que su mamá no la iba a
went through
apoyar y al
this,
contrario, las mamás
thought she could
somos
not
las
speak to
más
her mom
confiables en
because
los que pueden
didn't think her mom would
decir
support
las
her.
cosas que
But
les están
us
sucediendo.
as adults are
Y
the
ahí es
ones
donde
who can
uno va abriendo
actually be
una
supportive.
conversación con ellos,
So
pero
that is a way of
es
opening a
difícil más cuando ya
conversation with
están
them, but it's very
adolescentes.
difficult,
Es
especially
difícil
when they're
abrir una
teenagers. It's very
conversación,
difficult
pero
to open a
a
conversation with
través
them.
del tiempo
But
uno va
through time,
aprendiendo cómo entrarles a
you
la
learn
conversación,
how
uno
to
mismo va buscando
start a
astucias
conversation.
para
You
conversar
find
con ellos
ways
y
of
así saber
talking
lo
to
que
them,
ellos están pasando afuera, en sus
and
escuelas o
also
en su
a
vida
way of
cotidiana
knowing what is
como
happening to
jovencitos que
them
hagan
outside
fuera.
in their
Entonces,
school,
tenemos
in
que
their daily
aprender mucho
life,
los
because we need
padres
to
y
learn
pues
a lot.
ojalá que se repita
And
esta reunión
hopefully this
siempre para
meeting
la educación de
will
nuestros
be
hijos.
happening again because it's good
Gracias, Carla.
for our kids and their education. Thank you, Carla.
Thank you, Audi, for those closing words. Thank you, everyone, for joining today. So please look forward to an email that will be sent to you this week with all of those resources. And please, let's stay in conversation. If you have any questions, please feel free to contact Jocelyn. Her email is here in the chat. I know she put it in there earlier, but please feel free to contact Jocelyn, who's our main organizer for the campaign. And we look forward to staying in touch with you. Thanks, everyone. Have a great day. Thank you for joining us.
Gracias.
Thank you.